weeks. In the first 4 interviews, I got
Mute, unmute for us. Unmute, please. Unmute for us. We are back.
I'm looking for other question. That's why I'm talking. Let's for their business.
Wow. So you cannot mute the mic.
Come on, it's the tea. Oh, Jamie.
Hi.
Hello, are we done with the Zoom meeting? So we are waiting on, we have to conclude this section. It's the most important section.
Please just give me a moment, please. I just want to solve something here, please. I will just give me a moment. All right. Sorry.
Nice. Deixa eu
sorry for keeping you guys waiting. I needed a moment to think so I can be able to draft example for you guys. So sorry for keeping you guys waiting. We can continue now. Okay, so now, look at all this. So, I drafted something for you guys. So now, don't write introduction. I just put this here so that you'll be able to see what I'm doing. You don't need to put introduction. Do you guys understand? You don't need to put introduction. You get? So I just put this here for you to know. Dear Senate, dear, this can be small letter. Dear Sanila, I am delighted to be aware there is a vacancy for staff nurse at Royal National Orthopedic Hospital, NHS Trust, and I want to vehemently show my interest. I am strongly convinced I am qualified for this position. I am a nurse with an extensive experience working in an orthopedic establishment. Okay. I have 3 years post-registration qualification and experience working in an orthopedic settings. I am proficient in BLS. I am proficient in BLS, ACLS. So even if you state that you are proficient in BLS, ACLS, it's not as if you will just get to UK and they will start giving you a patient to operate on. They will still have to train you on the job. They will still, so don't be afraid to put it. Even if you do your BLS online, you do your BLS online or under bridge in Oshodi, don't be afraid to put it. Because if you come to UK, they will not just give you a patient dying and ask you to perform BLS or cardio CPRO on the patient. No. They will still have to train you. You will not come here and start giving injection. They will still have to train you on the art of giving injection, on the art of giving medication. So don't be afraid to put all those things. It's very important. So I am proficient in BLS. Okay, I'm proficient in BLS, ACLS. Spell all these things. Don't abbreviate it. Because of time, I am abbreviating. ABLS, PASS. So spell it out. Don't abbreviate. You cannot afford typographical error. Like I repeat, you can't afford a spelling error. So you have to check your work for spellings. It's very important. PASS and maybe whatever thing that you know that you are proficient on. And PASS. You can say and PASS. Okay. I use and use of hoist. How many of you, okay, let me say hoist. How many of you know what hoist is and use of hoist? Hoist is something you use to move patients. You know, something you use to move patients from bed to the wheelchair, from wheelchair to bed, yes. And hoist, and technically sound in computer. If you are good in computer, you can say and technically sound in computer. Do you understand? Because remember, in their supporting information, this is what they said they want. They said, teaching and assessing qualification, diploma, this qualification, experience, working within multidisciplinary teams, correct evidence-based practice, 2 years post, sound knowledge of the particular patient group, relevant experience in this or an associated specialty, 6 months to 1 year general nursing experience as student nurse within orthopedic settings. So you have stated that you have 3 years experience in orthopedic settings, which is stated here. 2 years post-registration, 2 years post-registration experience, supervision of junior staff and students working with PASS. You have stated that you have experience with PASS, managing change. So now we are going to include that you can supervise and also you have ability to manage roles if acquired. So look at the skills they said they want. Basic life support, you have stated it. Able to supervise and teach junior staff and students. able to prioritize and meet deadlines, able to manage difficult situations, able to assess, plan, implement, and evaluate programs of care. So I'm going to copy this. Sometimes you need to copy all of this. I will show you. I'm going to show you how you can do it. Don't be afraid to write plenty. The maximum words you can write in this page is 1,500, and you cannot exceed it. So don't be afraid. So this is the introduction. Bring all of this material. So let's say, and use of OS and technically sound the computer. And I will love to bring all of this experience to your organization. Okay, to your organization. The opportunities to join your organization is important to me because this is where you will now state it. Don't copy and paste like this. You have to arrange it. The opportunity to join your organization is important to me because I can say that with my vast experience, I am able to supervise and teach junior staff and students, able to prioritize and meet deadlines and meet organizational deadlines. Okay, it's already there. Organizational deadlines. No, you have to, in IELTS, there's something called modifying words. How did they put it? When you are writing. Paraphrase. Yes, you have to paraphrase it. Able to prioritize and meet organizational deadlines. Okay. Then you can also say able to manage difficult situations and reporting, I am able to assess. This is, you can put, I'm able to observe, assess, plan, implement, and evaluate. This is a care plan. Your care plan, remember ADOPI, assessment, diagnose, and so you can say, I'm able to assess, okay? You can put diagnose, remove diagnose first. I'm able to assess, plan, implement, and evaluate programs of care. Put client program of care. Okay. Above all, okay. This place, program of care. In another, above all, I have sound clinical skills. I am able to learn new skills. Then I can maintain clear and legible documentation of care, Okay, you can say, I have cared for over 20 orthopedics patients in the last, how many years experience you say you have? In the last 3 years.
3 years.
In the last 3 years. So which will now cover for this group of 6 patients, to remove this group of 6 patients. In the last 3 years, with effective communication skills. With effective communication skills. Okay? So you can see it's making sense. So now, this place, confidence in teaching, ability to supervise, train, ability to manage clinical sense of senior staff. Then you can say, in the absence of senior staff, this IT covers that you already have computer knowledge, so no need to put it again. Now, under this place, in the absence of senior staffs and managers, I have the required skills. See, you have to, I don't want to use the word lie, okay, because this video will be recorded and put on YouTube, but you have to sell yourself. Do you understand? I don't want to use, I'm recording, I don't want to use certain word, but guys, you know what I'm talking about. In the absence of senior staffs and managers, I have the required skill to manage clinical areas. Clinical areas, so you remove this one. Clinical areas. And I have the skill set of time management and effective delegation. As a leader, I have earned leadership skills that fit me in this position. Why are you breathing like that? It's true now. Then another thing again, knowledge, awareness of professional issues, practice within the scope of the NMC Code of Conduct, prioritize people's equality, diversity, and rights. Good. We'll copy this one. UK doesn't play with rights, so you must include it, that you have read the NMC Code of Conduct, and that you are very much aware and you are willing to promote people's equality, diversity, and rights. You must put it. So they don't play with rights. So you will put it here. So awareness of professional issues. So you said, you can say, I am very much you can say, I have acquainted myself. No. I have knowledge of the NMC Code of Conduct and okay. I have
professional issues.
Yes, and practices within the scope of my practices within the scope of the NMC Code of Professional Conduct. I have knowledge of the NMC Code of Conduct, NMC Code of Conduct as regards to my practices within the scope of the NMC Code of Professional Conduct in the UK, as well as promoting client rights, diversity, and equality. So you can see how I twisted it. And equality of persons. We are almost done. Awareness of the structure and organization of the NHS. So are you aware of the structure? So you put it, I have knowledge of the, okay. Furthermore,